Diane Voss, and I'm going to talk a little bit about vitamin B12 today. Unfortunately, it's a very common deficiency in the United States right now, and I give my patients all kinds of advice, and like most advice, people sometimes decide, well, I don't really need that, and I'm taking a lot of pills. So we're going to talk about it today so you can understand a little bit more about it when you make that choice of whether to take your vitamins or not. In the first place, actually, low vitamin B12 is pretty common. About 43% of the population will test in the lower levels, and there's several reasons for this. When you look at a normal level, it'll say that a level below 200 is deficient. However, about 20% of people with levels between 200 and 400 still have symptoms. And these symptoms, over time, if not treated, can become really nasty. If we catch them early, they're completely reversible or completely preventable. So in the United States, about 43% of people will test kind of borderline low normal. About 18% of people will test low, and about 9% of people will test very low. Something like vitamin B12 deficiency is something that comes on very insidiously or very slowly, so a lot of times people don't realize that they're developing something until they really don't feel good at all. There's a lot of symptoms that are associated with low B12, and one of the fun things about medicine is there's somewhere about 232 symptoms, and there's millions of diseases. So any given symptom in combination with other symptoms starts giving us clues as to what the actual problem is. So when you listen to this and you have two of the symptoms, I don't want you to go, oh my god, I have vitamin B deficiency. It's entirely possible, but the specific symptoms aren't real specific. So first of all, we're going to talk a little bit about causes of B12 deficiency, and one of them is dietary. Interestingly enough, vegetarians are more likely to have B12 deficiency because most of your B12 comes from dairy and meat. Although, in most studies, people that are primarily vegetation or primarily plant-based eaters do live longer and live healthier. So one little thing we have on the vegetarians. Other things that cause it is that you're just not getting enough in your diet, or even if you are getting enough, sometimes you don't absorb it very well. And people that have gastric bypass have all kinds of nutritional issues, and the two biggest nutritional issues they have is low B12 and low vitamin D because they're not absorbing those very well. Anybody who has leaky gut, or anybody who has bacterial overgrowth in their gut, these things interfere quite a bit with your ability to absorb it. Medications can cause all kinds of interference. The proton pump inhibitors and the histamine inhibitors, things like Prilosec and Protonix, Tagamet, Zantac, Pepcid, even the over-the-counter ones that are considered safe can interfere with the absorption of nutrients, and specifically B12. Other medications that interfere, and they interfere because they either interfere with the production of intrinsic factor, which happens in the stomach, or they interfere with the intrinsic factor itself and where it absorbs the vitamin B12 in your intestines. So one of those things is Metformin, which is used to treat diabetes, and some of the other diabetes drugs do seem to be associated with that as well. Anybody who's on Metformin should have their B12 levels checked regularly, and it very often causes low B12. Anybody who has metabolic syndrome, which is being overweight, having high cholesterol, having diabetes, and some of these things as they come up, it's not clear that there's a cause and effect. I mean, obviously somebody that has a metabolic syndrome probably isn't eating very well, probably is on medications, probably their gut is not perfect, and so it's a little bit hard to tell whether those situations are causing the B12 or whether it's the fact that they're on the medications. We see correlations, and correlations don't always mean that there's a cause. It does mean we should look for things because they are correlated. Birth control can interfere with B12, and there's a lot of people on birth control. Other disease states that can interfere with it is the non-alcoholic fatty liver. As your liver is one of the main places where you store and metabolize B12, and so if there are issues there, then it can affect your blood levels and the levels in the other parts of your body where you need it. People with polycystic ovarian disease are less likely to have good levels. People that have take huge amounts of folic acid, sometimes it masks or hides a B12 deficiency. Worms and parasites actually love B12, and so when people have parasites or worms, their B12 levels can be low. In terms of side effects, it's kind of interesting because I remember when I was in medical school, one of my instructors very dogmatically saying, well, it's a water-soluble vitamin, it's good for you, there's no such thing as too much. And we see that in someone who's recently had heart disease with a stent placed, it seems that if they take super high doses of vitamin B12, it actually can cause the stent to restenosis faster. It's not really clear what causes that. And so I think that for everything in the body, there's an optimum level, there's an excessive level, and there's a deficient level. And it's like with your car, if you put too much oil in the engine, it is not good for it. And if you don't have enough oil, it's not good for it. And so I am, for the most part, not a big fan of super high doses of anything. I like to put my people on regular doses, check a level, see where we're at, and adjust as necessary, even if it is a water-soluble vitamin. There's been a couple of case studies of some unusual rashes that people developed after taking really high doses of B12, especially when they took it in combination of B6. And a lot of these things can happen even taking it for a short period of time. It's interesting that in people with heart disease, when they took huge doses of B12 and folic acid, they seem to have higher rates of some cancers, and it seemed to actually be the super high doses of folic acid that may have had something to do with it. It's a little unclear in these studies. They're just studies that we go back and look at what doses people were taking and then what kind of problems they had. So it's unclear whether they had other things going on or why they were on those doses or whether they were actually taking high quality supplements or not. Methyl B12 is a type of B12 that your body can use the most. B12 is usually sold as cyanocobalamin because that's cheap. At least 25% of the population, of the population is unable to methylize their B12 effectively. And so those people, if they take methyl B12, they use it much better and it has a much greater effect than if you can give them all the cyanocobalamin in the world, but if their body can't put it into a usable form, they're not going to have quite the benefits. Again, the dietary places where you're going to get it are meat, especially poultry and fish, shellfish, and dairy. So some of the symptoms of B12, and this is one of those fun things, it's like I think that I work with this a lot, but I thought for this presentation I would go back and review it, and I got on about 10 different websites, and every website says something different. And I was like, this is crazy. I am so glad I'm a doctor because I can wade through this, I think, hopefully a little bit easier than the average person. So we're going to go through some of it. Most of the symptoms of B12 are not very specific. There are things like low energy and fatigue. Well, 90% of the population who comes into me says, I have that. It doesn't necessarily mean you have B12 deficiency, but we're going to check it. It can be associated with sexual problems, sexual difficulty, infertility specifically can be associated with low B12. People who have low B vitamin levels are much more likely to have depression or anxiety, much more likely to have muscle pain. People who have fibromyalgia, whose levels are low, their pain levels improve significantly if we get them back up where they're supposed to be. Low levels of B12 can actually interfere with thyroid and worsen hypo-thyroidism. Anybody who has digestive issues is likely to have B12 deficiency, but B12 deficiency also seems to have a negative effect on the way the gut works. Definitely impairs the ability of the brain to work. B12 deficiency does cause dementia, and if you catch it early, that's a completely reversible type thing. You're much more likely to develop Alzheimer's and dementia if you have B12 deficiency. And there's a lot of things coming out that if people eat clean and eat better, they're much less likely to develop Alzheimer's. And I don't think it's just the B12. I think there's a lot of other things associated with that. Autoimmune diseases are often likely to have B12 deficiency because pernicious anemia, which is not common, but it's a situation where your body is not able to absorb B12, and those people really need to have injections instead of replacement by mouth. And that's an autoimmune situation where your body attacks the lining of your stomach so that you don't produce intrinsic factor. So again, which came first? Do you have an autoimmune problem that's impairing your ability to absorb B12, or do you have a B12 problem that is making your autoimmune situation worse? And oftentimes we can't tell. But if we can start treating it, if we can start improving the diet, if we can give you supplements or shots and start moving in the right direction, you're going to feel a lot better while we're working out what got you there in the first place, so we can try to dig out of that hole. People that have B12 deficiencies do seem to be more likely to develop cardiovascular disease, although we've also said that taking way too much can be a problem if you've just had a heart attack or a stent placement. Skin problems, it's not uncommon to have either not enough pigment in patches like vitiligo. People with B12 deficiency are more likely to develop jaundice. You can get hyperpigmentation or unusual tanning that's not a real tan. In terms of the mouth and the skin, you can get glossitis, which causes a smooth, sore tongue, which is different than the furrowed tongue. It causes anemia, specifically anemia with big cells called megaloblastic anemia. It can cause low white count, which may be associated with increased infections. In fact, low B12 can affect all of the cells, so you can have a low white count, a low red count, and low platelets. And when that happens, you're probably not in a very good shape. On the other side of it, it can cause increased platelets or decreased platelets. So a lot of these things are very non-specific. So when I have somebody that has a lot of things, we try to find something that is going to start addressing those and then keep measuring and find out what's getting better and what we have to dig deeper on. As your B12 levels go lower, you can develop neuropathy, or the fact that the nerves in your legs and fingers and hands don't work as well. This again is reversible. That's kind of cool when we can figure out these things and fix them. You can have actually psychosis that improves with B12. People are more likely to be irritable. And again, does B12 make you irritable, or is not being able to think make you irritable, or is being tired make you irritable, or does hurting make you irritable? I mean, all those things make me irritable, and I do take my B12. You can lose your vibratory sense, which makes your balance go off. It can actually affect your ability to smell. It can make tinnitus more likely. And I think that part of the problem here is if your B12 levels are off, very often that doesn't happen by itself. Very often it's part of a bigger picture where you're having low levels of other nutrients. And the classic case is somebody who's had a gastric bypass. If their B12 level's low, they're not just low on B12. They're low on B12 and B6 and B2 and B1 and vitamin D and copper and zinc. And so a lot of times one of the easiest things for us to find is start working on the other problems associated with it. People that have the MTHFR gene, is the methyl tetrahydrofolate reductase, and I'm not going to say that fast 5 times. They do not methylate their B vitamins and tend to have elevated homocysteine levels, and they also need to have methylated folate. And high homocysteine levels in and of themselves are associated with significant increase in risk of heart disease and strokes and dementia. There have been a lot of studies on this, and in some of the studies it appears like replacing the supplements doesn't necessarily decrease the problems associated with it. But when you go back and look at those original studies, they were using the cheapest types of folate and the cheapest types of B12 that were not methylated. So I'm kind of curious as to what would happen if we did those studies again with the methylated products. Again, I think taking appropriate levels of this is not a bad idea. Overdosing, I'm never a fan of overdosing on anything unless it's ice cream. No, I don't. I think that goes through most of it. Oh, thinning hair can be associated with B12 as well. Gray hair sometimes. Now, sometimes beautiful gray hair is just genetic. Mine is. Everybody in my family has salt and pepper hair. I don't think in my case that's B12 deficiency, but certainly premature graying can be associated with B12. And I had a dog, a German Shepherd, that had that problem. It was kind of fun to fix. We talked about the chronic pain things, the neuropathy, increase of other issues that you have. If you have fibromyalgia and you have nutritional deficiencies on top of that, obviously there's going to be more of a problem. So I think I'm going to wrap it up there. That's most of what I know. If you'd like to learn more, then look at our website, get on the internet, do some due diligence, or come talk to us because we'd love to hear from you. Thank you.